So I thought I'd share with you what, just as something for yourself rather than anything else, you and your family, so that you understand what we are faced with today. That 50% of all deaths are going to be from cardiovascular disease. So that's a very serious matter, not only for us as young, or you as younger generation, but your parents and your grandparents, that you understand this very well. Because you can help to save their life and contribute to eliminating the burden on them, on your family and the society at large. The other big problem that we are facing today is diabetes, which is along with cardiovascular disease. Diabetes, we estimated, as you see in this slide, by 2025 there will be 60 million Indians who will have diabetes. But unfortunately today there are 60 million diabetics registered. We know about them in India. So we are way ahead of what even our predictions. And worse is that 70 million Indians are pre-diabetics. This is a very important slide which is actually related to all of you in this room. And I think if you can remember part of it, I would have done my job today. So if you look from left to right, the first three things that come up are age, family history, and the point that you have no control over your age, and you have no control of where you are born, and you have no control of which sex you are born. So those are the three important things which you are totally out of our control. The importance is, when you come down, that if there is disease in the family, especially if there is heart disease in the family, if one of your parents has heart disease, then your chances of developing heart disease becomes double. And if both parents have heart disease, then your chances become 3 times. If you find out by a regular checkup, which we recommend by the age of 30, everybody should get a checkup to see whether you are a candidate for heart disease or diabetes or any other predictive thing that we can find out. Okay? If we find out at that stage where we said you are asymptomatic, but we did the test and we found out that you're going towards heart disease, that's the best way to find out. The second way to find out is that when somebody develops what we call angina, which is if you're doing a physical activity or you're in an emotionally upset or stressful situations, you start getting chest pain, which goes away once you stop exercising or you stop walking. And if it slowly goes away and it's repetitive, it could be angina. And then we have tests with which we can tell whether it's from the heart or not. And then the third, which is the worst way of finding out, is once somebody gets a heart attack. That is a little late. So the difference between finding out in the first 2 circles is that there is a 99% chance in today's technology that if somebody comes to us before a heart attack with coronary artery disease, we can give them a full life 99% chance. However, if the heart attack is your first symptom or first presentation, then there is a 20% chance that that person will die. 10% before coming to the hospital while on the way, or 10% the first year after the heart attack. So the price to pay for missing heart disease is very high. So if you have the means, if you have the facilities in your neighborhood or in your city, then I think it's important to get a regular checkup, because the payoff of prevention is huge. Once disease takes over, it becomes a major problem, as I just told you, whether it is heart attack, or whether it's diabetes, or whether it's cancer. Once it lays its roots inside you, then you have a major problem for the rest of your life. Now we have got excess. We went in the totally other direction, because if you see, every day or every other day there is some celebration or the other. So कोई पास हो गया, किसी की शादी है, किसी का birthday है, तो celebration is always with either food floating in oil, or at the end you will find jalebi, rabdi, gulab jamun and kulfi. Because if you don't have that, that means you have not arrived, you are a poor man. So, there is no harm in eating that food, but the quantity you eat and what you eat together. So, what trapped in our thing is emotion. We attach emotion to food. So, आपने अभी जलेबी खाई और रबड़ी खाई और तो आपका दोस्त एक कुल्फी लेके आ जाएगा, कहते हैं बड़ी अच्छी है, इसको खा के देखिए. So then you don't want to refuse it, then you bloody killing yourself. So we need to put a little discipline in our head. And I always give this example. If you have a samosa sitting in front of you, and I am standing there in front of you, okay, if you eat it, you will live 5 minutes, you will die 5 minutes earlier than you would otherwise at the age of 90. So your puzzle is, should I gratify myself today or wait till 90 to live 5 minutes longer? So instant gratification has a lot of attraction. And there's nothing wrong with it. I personally am a bit of the road man. Everything in moderation is good. Okay, thank you. Thank you so much.